So many emergency departments had to change a lot of the way they treated patients throughout this pandemic, and that includes those in eastern Connecticut, where the COVID-19 wave was much smaller. Joining us now to talk about the situation there is Dr. Kyle McClaine, Chief of Emergency Services at Backus Hospital in Norwich. Doctor, thank you for being with us.
Thank you so much for having me on today.
So tell us about what your emergency room looked like since COVID-19 began.
Thank you. Starting in early March, we had a real precipitous decline in ED visits in both the Backus, the Plainfield, and the Wyndham emergency departments. We saw at one point volumes less than half of our usual, and also with local urgent cares also dropping their volume, we had a real fear about what was happening with the patients as everyone was trying to socially distance and stay away from other patients. Unfortunately, we did see that the acuity of patients that we did see and have been seeing have been a lot higher than usual. Unfortunately, what we saw a lot of was people who have had heart attacks who didn't seek treatment in the first couple of hours, where we can do things that make real differences in outcomes. We had delays in stroke care, where in the first 4 or 5 hours of a stroke symptoms, different treatment options exist. We saw people with infections that had progressed to the point of needing hospitalization or even surgery, where sometimes they could have been treated earlier. We saw delayed treatment of fractures and lacerations that led to infections and complications. So we've been trying to encourage folks to seek emergency care when they need it for themselves or their loved ones. We're currently rising back up to about 2/3 of our usual volume, but we're still concerned that people who need emergency care have not sought it during the COVID-19 pandemic.
Oh, that's so sad to hear, and we're hearing it all over on so many kinds of medical problems. All right, let's talk about what kind of safety precautions are in place in your emergency department.
Thank you. Everyone who enters one of our buildings, whether you be a patient, a visitor, a staff member, a doctor, everyone is screened upon entry for symptoms as well as the presence of a fever. If you are going to be seen in one of our emergency departments, we have separate triage tracks. If you have any symptoms or suggestions of a COVID-19 type illness, we have separated treatment areas as well. Everyone is wearing personal protective equipment at all times. The level of that equipment is scaled to the level of need of the patients. By having patients also always wear a mask and having them coached by our staff for hand hygiene and social distancing, we minimize the chance of any cross-contamination or spread between patients and staff. We've enjoyed a very, very low rate of staff members and physicians and other patients contracting illnesses. We're actually quite proud of that. So we have a very safe, carefully planned, well-executed pathway by which patients and their families get the proper treatment that they need without fear of limiting their own health care because of COVID-19.
All right, Dr. Kyle McClaine, thank you for joining us. We always like to hear from Eastern Connecticut, from Backus Hospital, Norwich. Thank you for your time.
Thank you so much.